has had a long-standing partnership with the SMS team, and we're excited about that partnership, and we're excited to continue to grow it going forward. As Sadie mentioned, my name is Todd Cowan, and I'm the National Sales Director for the Ameritas Dental Individual, Dental, and Vision products. So I appreciate you folks joining me today. I also want to thank those folks that are currently selling the Ameritas product. Thank you very much for your partnership. We appreciate you. And for those folks that are listening for the first time, we're excited about today's webinar. We're going to be rolling out our brand new products. So we've taken feedback from the SNS team and our current producers, as well as some folks are insureds. And we've built a new portfolio of products that I know you're going to be as excited about as I am. So as we move through our discussion today, we'll talk a little bit about our brand new plan designs that will be ready at the end of this month on the 28th of July. We'll talk a little bit about what makes them different and how they differentiate, how Ameritas differentiates themselves from the marketplace. We'll share a little information about our network and some exciting growth around our network, some best practices as it relates to cross-selling, and then we'll touch base a little bit on our brand new enrollment tool that rolled out about 60 days ago. So lots of exciting stuff to talk about. For those folks that may not be familiar, well, let me first talk a little bit about why dental and vision. So Ameritas has been in the dental space for 60 years. We've been in the individual senior dental space for 30 years. So as you'd imagine, a company that's been focused in the senior dental space for that long, we do a lot of research. We do a lot of market focus groups with our agents, talk to our top producers and get best practices. When we ask the question, why do our top producers include standalone dental in their portfolio, a couple themes jump off the page. First is that referral. It's from a best practices perspective, we're seeing our top producers use dental and vision as that door opener, establish that client in the off season, and then establish that referral base as they're moving into the open enrollment period. They already have kind of a book of leads that they can work. So using that as a referral database. Helping to increase persistency. Our data tells us that when someone has multiple lines of coverage, when an agent has multiple lines of coverage with a client, that client remains more persistent. So using dental and vision as a way to increase persistency in your current clients. And then adding value in your clients' lives. Our data shows that 71% of seniors that are aging into Medicare eligibility, 71% plan on purchasing dental in their post-retirement years. We know they're going to buy dental from someone. And we want to make sure that Ameritas gives you the tools to fill the gaps in traditional Medicare and fill the needs of your clients. So continuing to give you the tools to add value to your clients' lives. And then, of course, using dental and vision to grow your business and grow your commissions. These are some of the themes that we heard and best practices that we heard on why standalone dental and vision is an important part of an agent's portfolio. So we know why dental and vision, so why Ameritas? What makes Ameritas different? Well, first of all, it's that experience in the business. As I said, we've been in the individual senior space for over 30 years. We've got a $400 million in-force book of business. We believe that's important, or we believe it's important to work with a company with a long track record and domain expertise in the senior market. We spend a lot of time and money understanding buying behaviors, why seniors buy, what benefits are most important, and we make sure that our plan designs meet those needs. The next reason on why Ameritas, we've got a very simple go-to-market strategy. We try to keep it simple. The first is product simplicity, making sure that our products are very easy for you to understand, very easy for your clients to understand as well. Second is creating economic value, making sure that we're covering things like crowns, dentures, bridges with no waiting periods or no internal limitations. We don't have a limitation for implants, for example. That's covered as any other condition. So making sure that we create that economic value. And then ease of enrollment. We want to make sure that our enrollment tool. You can enroll in 3 minutes or less. It doesn't require multiple signatures back and forth with the client. You can self-serve, you can enroll your member on their behalf, or you can send a link out and they can enroll themselves. So again, 3 things in that go-to-market strategy: product simplicity, ease of enrollment, member value. Those are the cornerstones of the Ameritas product. They've served us well up to this point, and we'll continue to focus on those three building blocks. Moving on to product simplicity. The map in front of you is only an illustration to help demonstrate our products and how simple they are to understand. So you can see everywhere that's in blue indicates consistency with products across the country. Everywhere that's in black doesn't mean that I don't have product there. It means that I've got a state-specific plan. So really, this is just an illustration. You don't have to remember which plans are available where. The quoting engine and the enrollment tool is intuitive enough to do that for you. I only want to demonstrate the consistency with our products across the country. Our data is telling us now more than ever, we're seeing agents that are moving, that are not only focusing in the senior market, they're also selling in the under 65 market. So we're seeing a lot of overlap back and forth as agents are now, more than ever, the trends are that they're moving and they're working in both ends of the market. We heard that feedback from our agents. And so what we translated that feedback into some of the enhancements that I'm going to talk about today. Historically, the Ameritas portfolio has been one size fits all. We have one product that works from 18 all the way up through our seniors, which is fine, that works well, but we'd like to take more of a segmented approach with our new portfolio. So with that in mind, before we jump into the product portfolio, for those agents that may be in the senior market and you haven't moved in the under 65 market, or you haven't thought about that, I wanted to just highlight a couple of quick bullets on this slide. You can see some industry data here that tells you this under 65 market, ages 18 to 45, specifically in that 25 to 34 age bracket, is some of the highest rates, some of the highest uninsured rates in the country are in those age brackets. So they're underinsured or completely uninsured. So that talks to that market opportunity in that under 65 market. We're also seeing that 25 million people plus are part-timers or seasonal, and they don't have access to traditional medical or to traditional employee benefits or dental plans. So if you haven't thought about the under 65 market, something to think about. There's certainly an opportunity to grow your business down there. The other way around, for those folks that may be working in the under 65 market and haven't thought about working in the over 65 market, here's some interesting industry data. 1 in 4 seniors lack dental insurance today. 25% of them, when they're surveyed, they don't know how they're going to buy dental insurance in their post-retirement years. So they lack the education on how to even purchase a dental plan or where they're going to get it. And then the last one is probably the scariest data point, is around some seniors assume that dental and vision are covered under traditional Medicare. And of course, those folks on the phone today understand that the 3 things that are not covered under traditional Medicare are dental, dentures, and vision. So again, it all starts with that education of your senior members. Okay, let's talk about our products. Again, these are our brand new products. They are built based on feedback from everyone on this call, the team at Senior Market Specialists, and some of our in-force members. This is our Prime Star Total product. Now, this product, it is available. All of the Ameritas products are available at all age groups, from 18 all the way through top end into seniors. We don't segment our products, so anyone can enroll. There's no cutoff to enrollment. So as long as you're 18 and above, you can have these plans. However, you can see by the benefits from a marketing perspective, we focused in on the senior market. So a couple things I'm going to start off here in this red box. What are the unique, brand new things that separate Ameritas from the competition? The first is Preventive Plus. What I mean by Preventive Plus is that any expense, that's exams, cleanings, bite wings, any preventive expense that's covered under as a type 1 service, those claim dollars do not count towards the annual max. So you can see we've got a $2,000 annual max day one that increases to $2,500. Any service that is in preventative does not accumulate towards that $2,000 annual max. So that separates us from the competition. Hearing benefit. We heard you loud and clear. Our agents have told us that we needed to add a hearing benefit. So we did. You can see an annual hearing exam at $75 day one, and then the hearing aid benefit is $200 per year day one, and that increases to $400 per year for hearing aids after year number 2. And then, of course, the increasing annual maximums. So let's go down the plan, specifically down the left-hand side. And again, as a reminder, for those folks that may not be selling the Ameritas product today, Ameritas plans are available with next day effective dates and no waiting periods on this particular plan, no waiting periods for any covered benefits. So what I mean by that is you can work with your client today, you can enroll them today, they can start their coverage tomorrow, and they can see the dentist tomorrow and begin to get their day one benefit. So let's move down on the left-hand side of the page. You can see the max benefits start at $2,000 annual maximum and increases to $2,500 12 months later. Preventative Plus, we talked about that. Deductibles, 0 deductible for type 1 and a $50 annual deductible or benefit year deductible for type 2 and 3. Preventative covered at 100%. Again, preventative, anything in this bucket does not count towards the annual max. Type 2 benefits, fillings, and extractions start off at 80% and then increase to 90%. For those of you that are currently selling the Ameritas plan today, this is an enhancement, increasing our coinsurance levels to 90%. Major services, this is day one coverage for endo, perio, crowns, bridges, dentures, implants. Day one at 20%, increasing to 50% 12 months later. Here, annual hearing exam, we talked about that, $75, and then starting off at $200 per year day one and increasing to $400. So again, a lot of enhancements and improvements on this plan based on your feedback. Preventative Plus hearing aid, increasing to the $2,500 annual max. Anyone can enroll this plan. However, it was built, you can tell, it was built specifically with the senior in mind. Let's talk about our next product. For those folks that are working in the under 65 market, this product was built to resonate with that audience. Now, a senior can buy this plan. There's no limitations at all if they're interested in buying it. And so let's go through some of the benefits. Preventative Plus, we've talked about that. Coverage for LASIK. We believe that this separates us from the competition. We don't see any other individual dental insurance carrier out there giving LASIK coverage day one. Teeth whitening. We believe this separates us from the competition. We're going to give day one coverage for teeth whitening. Child orthodontia and an increasing annual max. Let's take a look at the benefits as we go down the left-hand side of the page. Max benefit starts off at $1,000 and moves into that to $2,000. Preventative Plus, 0 deductibles for type 1 services, $50 deductible for type 2s and 3s. Again, preventative, exams, cleanings, x-rays. We've added in fluoride, sealants, and space maintainers for those folks that have a family. Again, all covered at 100%. Basic type 2 services start off at 65% and increase to 80% 12 months later. Type 3 services, this is where crowns, dentures, bridges, teeth whitening is also in this category. Starts off at 20% day one and then increases to 50%. Child orthodontia starts off at 15%, then goes to 50%, and then LASIK. We're excited to offer this LASIK benefit, $125 per eye, and that grows to $250 per eye. So again, this plan design was built with the under age 65 folks in mind, more the full family. However, there's no limitations. A senior can purchase this product if they're looking for a little bit of a lower price point, or maybe they're looking for LASIK or teeth whitening. They're certainly welcome to purchase this plan. The next benefit is new for Ameritas. The next plan design is new for Ameritas. What we're looking here is, we heard a lot, what we're looking to target for this product is that value buyer. We heard a lot of feedback from our agents that said, we like the senior products, we like the higher annual maximums, but we do have a part-timer, or we've got a seasonal employee, or an Uber driver, or we're looking for a price point that has a product that has a $17, $18, $19 price point. And so that's really what the value plan was designed for, someone who is looking for a lower cost plan, who's focused on that preventative benefits. So you can see a lower annual maximum, however, preventative plus is included. So anything in the preventative services do not tie towards or do not accumulate towards the annual maximum. And then you can start off at 90% and goes to 100% for type 1, 50 to 80% for type 2, and then we do include a small amount of major services, type 3 for major services after year number 1. So again, someone that is looking for a preventative only plan, this plan would fit that need. Let's talk a little bit about the value of our network. So from a network perspective, Ameritas has one of the largest networks in the country. And some of the key features, some of the things that we think are important to know and understand about the network, first are the rate stability. So to the extent that Ameritas can control the cost of claims, that helps keep the rates down for everyone, for all the insureds, both on a new business and the in-force. And I'm proud to say that Ameritas now will be the second year in a row that we don't have a rate increase to our in-force clients. Again, it's all about the value of that network, controlling those claims costs and creating that rate stability. Contracted fees. Ameritas has negotiated fees or contracted fees with each of our 130,000 providers. And the value of those contracted fees to the member is a reduction of the billed cost. It's a reduction. Those providers have agreed to billing a lower rate, anywhere from a 20 to a 50% reduction in their billed fees just by being an Ameritas member. So we believe that creates member value, or that economic value. No balance billing and no claim forms. So no balance billing really means no surprises in the mailbox 2 weeks later. Your members don't get a bill from the provider above the contracted fee. Those providers are contractually bound to only bill the contracted rate. So we believe there's a tremendous amount of value in members going in network. Let's talk about the Ameritas network. I'm excited to say the Ameritas network has grown 70,000 access points over the last 12 months. Currently, that takes us to 583,000 access points with over 130,000 unique providers. And from a definition perspective, what I mean when I say access points is that's a brick and mortar location where someone can receive dental care. And a unique provider is just that. There's 130,000 unique dentists that work inside of those 583,000 access points. We talked a lot about member value, economic value, and the attached is just a quick illustration on how that member value is created. And so I think the easiest way is to walk through an example. We have an uninsured member goes into a dentist and they need a crown. They have no insurance at all. That dentist is going to charge them $1,368. They contact you, their agents, and they enroll in an Ameritas dental plan 24 hours later, just by being an Ameritas Dental member, that contracted rate, it drops from $1,368 down to $803. And then we talked about that day one coverage for crowns back on the total plan. That day one coverage, co-insurance level applies. So the illustration here is within 24 hours, by enrolling one of your members in a total plan, you've taken them from $1,368 out of pocket down to $642 out of pocket. You've saved them 53% in 24 hours. And of course, our co-insurance has increased over time. And so you can see you've saved them 71% as that co-insurance increases 12 months later. Let's talk a little bit about vision benefits. A couple of things that we want to focus in on vision that make Ameritas different. First, Ameritas is the only carrier that we're aware of, individual carrier, that has relationships with both IMED and VSP. So there's two different plans to choose from. In addition to that, the Ameritas vision plans can be sold in conjunction with, along with the dental plans, or they can be sold standalone. So those two things we believe differentiate Ameritas. Why vision? We talked about why dental. Ameritas views vision equally as important as dental. And so, our data tells us, our industry data shows, vision, poor vision increases the risk of fractures and falls, increases the risk of identifying medications, increases the difficulty around those ADLs, the activities of daily living, of bathing, dressing, etc. So we believe that vision is an important part of the overall wellness of your clients. Let's talk about our first vision plan. We talked about how we had two. Our first vision plan is the select plan. IMED is the provider network, and you can see some of the locations: Lens Crafters, Pearl, Target, Contacts Direct are some of the providers in the IMED network. This plan is a very comprehensive plan, very straightforward, with a little bit more of the value buyer in mind. You can see the frequencies, 12, 24, 24. So what we mean by that is that your clients can get an exam every 12 months, eyeglasses every 24 months, and frames every 24 months with a $130 frame allowance. The rate for that, you can see the rate in most states is $10.67 for a single. And then you can see we do have a few state specifics, Florida, Minnesota, and Mississippi at $8.54. Again, a very comprehensive plan, very low price point. VSP is our other option. This is a little bit more of the big box stores. So you've got Costco, Walmart, Sam's Club are some of the locations that are in the VSP network. A little bit more value, or a little bit more benefit rich plan. You can see the last plan was 12, 24, 24. This is 12, 12, 12. So what we mean by that is exams every 12 months, eyeglasses every 12 months, and frames every 12 months. And with a $150 frame allowance. So a little bit more benefit rich. You can see most states are at $16.34, and we have a few state specific plans at $13, just over $13. I want to talk a little bit about, so we talked about the value of the dental plans, next day effective dates, no waiting periods on our senior plans and our access plans. Now we've got a hearing benefit, LASIK, teeth whitening. We also talked about some of the importance around offering vision insurance. On the screen, you'll see some of the member tools that are that automatically are included when your client purchases a dental plan. So you can see the Find a Provider tool. I'll show you an example of that in just a second, the ability to search for providers. Dental Cost Estimator. The Dental Cost Estimator helps your clients, they can search and do research on how much a particular procedure is in their particular area. This helps them budget what their out-of-pocket expenses will be for a particular procedure. Dental Health Report Card. We keep track. Our claim system feeds into the member portal, and we help with gentle reminders when it's time to get your cleanings done or the importance of getting your regular cleanings. So we help keep them up to date on how they're doing in a report card format. Prescription savings cards comes along again with the dental plan. Eyewear savings card also comes along with the dental plan. And then the last is a worldwide assistance. And I think this is an important reminder. What the worldwide assistance provides is if there's any member that's traveling outside the United States and has a dental emergency, they can contact Ameritas, and we'll reach out to local providers through language line if we have to, but we'll reach out with those local providers and help get the emergency services that they need that will bridge them until that member gets back to the U.S. Agent tools. We've got an agent tool through our agent microsite. Some of the things out on our agent site to help you. We've got a sales support research page, social posts that are compliance approved that you can use either on Facebook or on Instagram or on LinkedIn or whatever social media outlet that you're familiar with. We've got social posts that are ready for you to use. We also have some podcast information if you want to hear a little bit more about our products, and podcast information is out there. Additional training materials are out there, how to cross-sell during open enrollment, etc. So we've got a lot of agent tools that are at your disposal as well at the microsite that's on the screen. For those of you that aren't doing business with us today, I want to talk a little bit about the process of enrolling members. So we want to make sure that we're an easy company to work with. So from an enrollment perspective, we don't take any paper enrollment applications. We have a straight through enrollment process. So what I mean by that, for those of you that are not appointed, once you work with the senior market specialist team and you get appointed, you're going to receive a unique link. That is uniquely yours. That's how we track your business. That link will allow you to quote and enroll on your member's behalf, or you can send that link out to your member and they can self-serve. As long as they use your link, you're going to receive credit for it. It is a straight-through process. So what I mean by that is at no point is the application touched by a human. You can enroll your member today. They can select an effective date of tomorrow. That gets enrolled. Their application gets submitted through a batch process overnight, and they can go and see the dentist tomorrow. So again, no delays at all in the underwriting or the issuing process. From a quoting perspective, again, we like to make it as easy as possible to quote. We're going to ask minimal questions to get you the rate or your member the rate. You can see we're going to ask the zip code. We're going to ask if they want dental coverage or vision coverage and who's to be covered. After we get that information, we're going to pull back the plans and the rates available in your area. We're going to pop up to the top our most popular plan based on recent sales in that particular area. The plan benefits are clearly outlined here for you. As if your client is self-serving, obviously it's something they can access as well. Find a provider tool. We have an easy link out to find a provider. Your client can enter in the city, state, or zip. We also have additional filters if they're interested in seeing, maybe they're looking for a Spanish-speaking provider, or maybe they're looking for an orthodontist. We have the ability for them to search by a particular specialty if that's appropriate. We bring back all the providers that are available in their area based on the criteria that they used. We highlight in green those providers that have agreed to the deepest discounts in their area. All the providers on the website and all the providers that we return based on their criteria are in-network providers. However, we highlight those with the deepest discounts that will give your client the deepest savings. After your member enrolls, during the enrollment process, your client will enter in either the credit card information or the bank account information. They'll push the submit button, and you and your client will receive a confirmation email. Once that confirmation email sets the expectation that they will receive their enrollment materials electronically within 3 to 5 business days. So again, to recap, what's in it for the agent? Ability to sell products 12 months out of the year. We are not limited towards an open enrollment period. Use the time outside of open enrollment as a chance to establish those relationships with your clients. Get your foot in the door. Establish that lead database. Remain relevant. Be that one-stop shop. We know that clients are going to purchase dental. We know that your seniors are going to buy dental, and we want to make sure that Ameritas gives you the tools to fill your clients' needs and to fill the gaps in traditional Medicare. Increase persistency on your book of business by adding dental to your in-force clients, and then of course continuing to add value to your clients' lives. From a next steps perspective, if you are not already appointed, please reach out to the senior market specialist team. They can help you get appointed. That process is very fast. It takes just a couple of days. Once we complete your appointment, again, you're going to receive your enrollment link. That enrollment link means that you are up and ready to sell. So with that, Sadie, that's what we have. I don't know if we have time. We've got just a few minutes here for question and answers.
Yes, absolutely. We can definitely roll into that. Thank you so much, Todd. You went over a lot there, so I'm sure we'll have plenty of questions here. We do have a question here. Someone was asking about the premiums, and if you could go back to the slide that went over those dental plans and the premiums on those, and yeah, just take a second look at that.
Sure. Yep. Happy to do that. Hold on. I'm sorry. I'm probably making you a little nauseous by scrolling. I apologize with that. Okay. So this premium, our average premium on our products on an annual basis is $505. That's an aggregate annual across the country. So that's going to be roughly, I'm hoping so it's going to be $505 for this plan. When we move off to this product, the Access plan, that's going to be anywhere from 12 to 15% lower cost as our benefits reduce from an annual maximum perspective. So it'll be in that 12 to 15% lower than our highest priced plan, our highest benefit plan. And then of course our value plan is at that opposite end of the spectrum. And this plan, again, starts at $17 and will work to that, $18, $19, $20, depending on where you are in the country. We have multiple rate areas. I'm hoping that wasn't helpful. I don't know if there's a specific question around the price.
There wasn't. So yeah, there wasn't.
Okay.
So if William, if that answered your question, great. If not, go ahead and ask specifically while we have Todd on here. But let's see. Okay, we have someone asking, do you have providers that take payments over the amount covered?
Do I have providers that take payments over the amount covered? So I think I'm going to say the question back. I just want to make sure that I'm understanding. So if someone exceeds their annual max, let's say they exceed their $2,500, we will still provide, they'll still get the value of being an Ameritas network and the value of that discount above, they'll still get the discount on that procedure even though they've exceeded their $2,500. Because they're still an Ameritas member, however, the benefits have stopped, right? Because they've exceeded their annual maximum, but they still get the value of the discount, the negotiated rate. I'm hoping that was it.
Awesome. Yes, that sounded like.
Okay. I was trying to get there. Okay.
Sure. Yeah, that's great. Let's see. Is the podcast something we can post on our website for prospect to listen to?
Yes. It's available on that the microsite that was in the deck, and I'll make sure that Sadie has this particular deck that we went over, so you can all see the podcast in the microsite address. But yes, you can. It's yours to use.
Awesome. Let's see. Preventative Plus, does it cover all costs in preventative? Yes. Does it cover all costs in preventative?
Yes. So
okay.
You got it. So let's just go back. I just want to you can see the services in there. So exams, cleanings, bite wings, and x-rays. Those are the covered services in preventive in type 1. All of the expenses, the cost for exams, cleanings, bite wings, and x-rays, these covered services, any of these expenses will not accumulate towards the 2,000 annual maximum. I'm hoping that was helpful.
Awesome. Yes.
Okay.
Let's see. We have someone asking if this is recorded. Yes, it is recorded. So if you have questions, ask them. But also you'll have this recording to refer back to on our YouTube page and also in our follow-up email. Let's see. Okay, so someone's asking about that Pearl link. Can a prospect enroll themselves via the link?
Yes, the prospect can enroll themselves via the link. Once you get your link, you can put that on a web page, and members can just self-serve against your web page. You can email that out to a member, and they can self-serve. Inside of that Pearl, that link has your phone number. So let's say that you email it out to a client, we'll always refer them back to you. So in the middle of the enrollment process, if they have a question, it'll say your agent's name is with your phone number. So, but that unique link, that unique Pearl, is how we tie that business back to you, ultimately for credit and commission purposes, etc. But yes, they can self-serve.
Awesome. Let's see. Is the benefit calendar year okay, I'm sorry. I'm having a hard time reading these tiny things. Is the year benefit calendar year or plan year when they sign up?
It's plan year.
Plan year, okay.
So let's keep going. That was a short answer. Let me give a more complete answer. So if someone enrolls for an 11/1 effective date, their plan year will be 11/1/2021 to 11/1/2022. It doesn't follow the calendar year. It's going to follow the plan year.
Okay, and then we have another question kind of along those same lines. Is year 2 a calendar year or anniversary date of initial enrollment?
Anniversary date. So plan year and anniversary date, those are the same. So in my example, right, it'll be anniversary. If I start on 11/1, my anniversary will be 11/1/2022. So it's all on an anniversary.
Okay. And we also have a question, how often do you all raise the premium usually?
We go through an annual life cycle. We have a very strict product life cycle process. And what I mean by that is we take feedback in the fourth quarter of the year from all of our distributors, from our agents, etc. We make any plan changes. We file any plan changes and any rate adjustments. We do that in the first part in the January of the year, and we implement any rate increases or any plan design enhancements on August 1st. This happens of every year. Now it happens to be July 28th, but for this, July, August timeframe. So we do it on an annual basis. And as I said, the book of business is running fine. And so there are no rate increases for August of 2021.
Awesome. Will most non-network dentists accept Ameritas?
Yes, most non-network dentists will. However, let's continue on with that answer. A non-network dentist, most will accept the reimbursement rate. However, there are still some that will balance bill. What I mean by that, just for a clear explanation, is if a dentist does not accept the reimbursement that Ameritas provides them, because they're not under contract with Ameritas, that dentist does have the ability and can, if they want to, can balance bill the member for the difference. And some do.
Awesome. These are great questions. You all keep them coming. I'm going to ask a couple questions that I have of myself and see if we have any more after that. If not, we'll get everyone out of here, back to your day. But I have a question really quickly. This is sort of random, but you mentioned something on there about the social media. Those are so that's social media content that these agents can use on their own platforms, correct?
Correct. It is social media platform that the Ameritas marketing team has put out there, whether you use it in an email, whether you use it in social media, LinkedIn, or what have you. So yes, it's free to use out there. It's
Love
all
it.
compliance approved.
Yes, awesome. Love that. Definitely something that agents should be taking advantage of for sure. So is that the only marketing materials that you all have available on there? Or is there like flyers or like other things like that that are also available?
There's other things also. So you'll see our traditional brochures, right? So you'll see a brochure that has, total plan, and it'll have the uh, the rates on there as well in our brochures. So traditional marketing brochures. Then we have a few flyers that are more geared for an agent to use for a consumer. So if an agent on the call wanted to send out a flyer to their in-force clients, if they have a flyer that talks about the value of working with Ameritas, and it has a fillable PDF where the agent can put their name and their contact information in it. So there's a few flyers out there they can use as well.
Awesome. Awesome. Love that. And then we don't have any more questions, but I do have one more question before we get out of here that I like to ask, especially whenever there's new features and new products involved. Is there anything, Todd, that you are particularly excited about, maybe in the new features, or just over really anything that you covered today, since you work with this on a day-to-day basis and you see what's kind of goes in and out and whatnot?
Great question. I'm kind of excited about all of it. So, I'm really excited about the Preventative Plus. That I think is a differentiator for Ameritas. Certainly, the addition of hearing, that was a response that the agents. It's nice to be able to respond to the agents as they ask for something to build the product, based on their feedback. So I think I'm excited about Preventative Plus and the hearing the most, and certainly, I'm also excited about the LASIK and the teeth whitening in kind of our under 65 products. So I'm excited about all of it. I'm excited for a great year. And again, I want to thank everyone for the time and all the support for those folks that have been loyal supporters of Ameritas over the years. We thank you for your support, and we're looking forward to continuing to grow the business with you.
Yes, absolutely. Let's see. We actually do have one more question here, and then we'll get everybody back to their day. If someone already has a plan with Ameritas, how can they upgrade to new plans and keep me as their agent? That's a great question.
So upgrade to the new plans. These products are really built for new business going forward. So there's not necessarily a crosswalk where someone can change to these at renewal. And so for someone to enroll in a new plan, they would need to cancel this current coverage and use your link, your Pearl, the unique link that Senior Market Specialists will give you. They'll need to use that unique link to enroll. And as long as they use your link, you will be the agent on their new case.
Awesome. Alrighty, well, that's what we have for you all today. There was a lot. I hope you all learned a lot. I hope you're excited about a lot. This was really fun. Thank you so much, Todd, for being here, and Ameritas for being partners with us. We really value that relationship, like you said earlier. So thanks for being here.
Thank you. Appreciate everyone's time.
Awesome. Alrighty, we'll let you guys get back to your day. Again, remember this was recorded. You can watch this later, watch it on our YouTube channel. Also, we'll have that follow-up email and possibly follow-up call as well. So we'll let everyone get back to their day. Thank you so much.
Take care. Bye-bye.